Hello and welcome to examination of the knee. It's James Burgess. This is our patient Richie, who's kindly agreed to volunteer today. So what we start off with is firstly with posture. So if you'd like to stand up for me please, Richie. I'd like to put your together like this for me. So we're just looking for a normal alignment of the hips, normal alignment of the knees, ankles. We're also looking at the feet, which there's normal arches to the feet. There's no issues with that. Looking at the shoulder alignment. If you'd like to walk towards the wall there, just normal walking and back again. And then back again for me please, Richie. And then on your tiptoes please. That's it, and just do a bit of walking again to similar points to before, and back again please. Okay, so he's walking on his tiptoes, and then you walk on your heels as well please. Just on your heels like this. This is assessing for any gross neuromuscular issues. If there was, he would not be able to perform this test. Now we're checking for balance. So what I'm going to ask you to do is one leg straight, the other one bent down. That's it. Okay, and on this side, so there was a little bit of difficulty with core stability there, particularly on the left-hand side, so there suggests maybe some minor weakness of the core muscles. Okay, I'd like to just come up onto the bed therefore. So because knee pain could be due to other areas of the body, we're going to assess firstly whether it could be to do with the hip. So I'm just going to bend up your leg, if you don't mind, Richie, out to the hip, and then do internal and then external rotation of the hip. Any pain at all? So there's no pain there. Sometimes the knee pain is referred from the back. If you'd like to bend forward for me, do you have any pain in the back at all? Do you have any back pain normally? So it's unlikely to be radicular pain. That's what we've assessed now. So now we're looking for any gross weakness in the muscles around the knee. Can you bend up, lift up your leg? Can you bend it for me? Straighten it out. So, and do the same on the other side as well. So it appears that there's no obvious issues there. So we're just going to have a look down here. Any issues with sensation in the distal leg? So there appears to be no weakness or sensory issues with the leg at this point. So now we're looking at the knee, looking for any deformity, any swelling, any redness, any issues with the knee, and we can't see any on this occasion. So now we're going to look for palpation of the joint. Any pain here on the medial joint line, the lateral joint line, across the joint here with the tibia plateau, any pain there? There may be pain at the tubular tuberosity, which we're palpating now. Any pain here in Burgess disease, so we're just doing that. Any pain here, just above the patella? Any pain on the patella? There could be patella pain if the has patellofemoral pain, could be anterior knee pain. So now we're going to check for an effusion, so we're going to milk the fluid down from the top, and there's no pouching out there. And we're going to do it out from the lateral to the medial side, and there's no pouching there, so there's no fluid. And then we're going to block the patella, which we're not able to do. So again, there's no effusion on this point, but we're checking for an effusion. If you'd like to bend the knee up for me. Here's full range of movement. It appears in the knee to about 120-30 degrees, so that appears to be normal. If I like to straighten the leg down, and normal range of extension with a little bit of hyperextension, which you would expect. And that appears to be the same on both sides. If you'd like to bend this knee up, just comparing the two there, that's fine. Now we're just going to check for any instability in the knee by doing a Lachmann's test. So we're just going to bend up the knee just very, very slightly. We're going to stabilise the femur, and then we're just going to press up on your bone here, okay? So we're just going to lift up here, and try and relax your legs as much as you can. So there's no instability there. And the same on the other side, do the same. Okay, so now we're going to test for the medial collateral ligament. So just like that, and then we're just going to apply a varus force. Any instability there? And then we're going to apply a valgus force. Looking for an endpoint there. It doesn't appear to be an endpoint. That's better. Okay, so that's fine. And we do the same on the other side. So we're just going to apply a valgus force and then a varus force. No major issues there at all. And if you'd like to just bend up your knee for me. I'm just going to sit on your foot, and this is just for looking for posterior collateral ligament injury here. So we're just going to apply a force to the tubular tuberosity. Any pain there at all? No, so it doesn't appear to be an issue. If we were going to assess for a meniscal injury, we'll go on to do McMurray's test, which is when we bend up the knee here, and then we try and cause internal and external rotation to try and cause any pain on the lateral or medial joint line. Any pain on the medial, on the sides of your knees at all? No. So we haven't assessed that. And if we suspected meniscal injury, if you wouldn't mind just getting up for me, please. Can you try to squat down for me? pain in the meniscus could cause injury and pain and squatting. If you'd like to go over there, that's fine. Okay, no, that's fine. Just going to check for patellofemoral issues, okay? With patellofemoral issues, there could be some pain. We're just going to move your kneecap out to the side. Any pain on that? So there's no kneecap pain when we move it out to the side, and no issues there at all. That concludes our examination of the knee. Thank you. Thank you, cheers. Okay, that's 5 for me. Just have a look.
When you do MCL and LCL tests, and I'm going to do it to have the knee slightly flexed, not straight, does it matter?
Well, basically they do it both ways, basically.